So welcome back to the program, and thank you so much for being a part of Good Morning Kenya this fine. Thank you for your responses online. And as far as the conversation that we're having on air is concerned, the hashtag continues to be Good Morning Kenya at KBC Channel 1, at Sam W. Njoroge, at Jain Wambui. Let us know what you think about family planning, what questions you have. We have Dr. with us right here in studio, and we'll be in a position to answer all your questions. Some, most, if not all. And off air, we were having this very interesting conversation, and I was put to task to describe whether or not I would prescribe to a vasectomy. The answer is no. For me, no. I know Dr. said it's a minor procedure, but when you think about it from a macro point of view, there is nothing minor about a vasectomy. Or am I wrong, Dr.?
So physically, it actually is a minor procedure. Psychologically, it can be macro viewed. And looking at the long-term future of that particular person's sexual health, I think it's a potentially a very good idea.
And what informs this notion that having a vasectomy actually improves your sexual activity?
Right. That's a very interesting thought process, actually. So it's been recognized, and we actually write about it in our scientific literature, that there is a possibility after vasectomy that your sex life may actually improve. This is, of course, got to do with the fact that the largest sex organ is between your ears.
That's the brain?
That is the brain.
Jane, is that true?
I want to read a tweet from a guy, Robin. He says, Robin Dupius. He says, getting snipped is not a big deal. Yeah? It's not like you're getting your testicles cut off. Men need to get past the notion that their virility is impacted by a vasectomy. Personally, I don't know anyone who has been traumatized by a vasectomy. So is it a question of just the mental battles that men get to struggle with when it comes to vasectomy, as opposed to the actual consequences of the procedure?
I think it's ignorance. It's ignorance of not knowing what the procedure is, what's going to happen, and how will they deal with it, right? As Sam was very delightfully giving us details about his last medical exam while we were off air. Sorry, I have to bring this up.
No, it's okay.
The very fact that you want to be examined as a male in your private parts brings about fear and makes your hair stand on end.
Thank you.
But why is that? Is the fear of more traumatizing than the actual examination?
Yes, I totally agree. The fear of it is worse than the actual action.
In most cases.
In majority of the cases, in a vast majority of the cases. Men are not touchy-feely creatures.
Thank you, Dr.
Right? And therefore, the very aspect, the very thought of somebody coming close to you and without your express
permission.
Well, you have given permission.
Yes, you have given permission, per se. You are being invaded, essentially. Means that it can be unsettling, to say the least.
It is.
Yes.
It is, and that's the reason now that my medical checkup is out there.
But if you look at it from your macro point of view and say, listen, I'm going to get this done. It's going to be a 15, maybe 20-minute procedure.
20 minutes?
Correct. Mostly, many times less.
So someone will be all over my business in 20 minutes?
That's correct.
Oh,
yes.
man, you need to go through childbirth. You want to talk about somebody being in your business? Samuel?
So it's not happening. It's not. I'm sorry. And yes, I literally walked out. I could not bear the thought of going through it. I think also I encountered a medic who was a bit very expressive in terms of, how he's gonna handle it. So I was like, no, this is not happening to me, not today. Not today.
It actually is a minor procedure, the vasectomy. There's the current standard is that urologists are supposed to be doing them in the office.
Yeah.
So you come in to their office for a consultation, you agree. If the man is very sure of what's going to be happening and why he wants a vasectomy, if he understands the potential risks and understands that this is most likely going to be for the rest of his life, he's not going to be able to have children normally, naturally, then the urologist actually lays him down on the couch and goes ahead to perform the vasectomy. And this is standard, this is international standards. Here in Kenya, we're a little more orthodox. We make sure we take them to the operating theater where we have the appropriate instruments and sterility. We still go ahead with the procedure. It still takes about 10-15 minutes, maybe 20 minutes. It's still, in fact, the latest procedure is called a no scalpel technique. So there's not even a knife involved in it. So it actually is a fairly simple and straightforward procedure.
Is there pain involved?
Yeah, is it general anesthesia or local?
It's complete local anesthesia. You do not need general anesthesia for this very minor procedure.
But will there be pain?
Yes.
There will, for how long?
It depends on how your body reacts to the inflammation that comes about due to trauma, due to the tissues. But majority of the times, there'll be a day or two of soreness. So we advise tight-fitting underwear. There's a possibility that you may have a bandage around in that area that keeps that prevents the bleeding. Ice packs are sometimes quite helpful in such cases. And after a couple of days, you're fine.
You said ice packs.
That's right.
To help with the swelling. Now, also, allow me to just jump in at this particular point.
Sure.
Now, when you are having a patient who has come, presented themselves, and they want to have this procedure done, a vasectomy, what are those checkpoints that you make sure they understand? Like, as a man, what are those boxes you need to check to be sure that you want to go this way?
Right. I want to make sure, personally, this is how I do it. I want to make sure he knows what he's doing. Very rarely, there's a possibility of psychological disease whereby the patient has undergone, this male patient in this case, has undergone some form of trauma previously. And this has led to his decision. And this is rather unwise. It's unwise to go ahead with the procedure when you recognize that there's trauma or background trauma that has brought about this wish for sterility. There are those are the more important things. Physically, there's hardly many reasons that we know of that could prevent. Not at all. I mean, you can have a vasectomy at any point in time. We know that 65, 70-year-old man can go ahead and father children very comfortably. So, though as age progresses, the quality of the sperm declines, right? We are all aware of that, but there are still viable sperm that can bring about pregnancy even in those later years. So the age is not a factor. When we look at younger people, younger men as well, you've got to be even more careful now, because you need to recognize that you need to understand why they're opting for such a macro decision, so to speak.
Yeah, macro. It is a macro decision. And even borrowing into the question that Moher is posing online, he'd like to know what are some of the factors that influence the quality of sperm for a man.
Right. That's quite a detailed answer to that, and I'll just go through it very, very briefly. The majority of men have no issues with their sperm. Sperm has essentially two things: quality and quantity. You've got to recognize that when a man ejaculates, his ejaculate is not just sperm. There's a lot of guiding, supporting fluids that come with the ejaculate.
It's an entourage.
That's right. Very well put. Thank you. Yeah. So
the crew is rolling in.
Correct. And the heroes, of course, are the sperm. Now, the sperm, they have quality and they have quantity. So there are certain times when quantity is reduced. When you talk about not allowing your testicles to produce enough numbers of sperm, if you are ejaculating twice or thrice a day for days on end, at the end of after a few days, you're unlikely to have a significant number of sperm within your ejaculate. In terms of quantity, there are normally a certain percentage of sperm that are not normal physically. They do not swim well because they're supposed to have the swimming motion with their tails. They may be shaped differently as well. And these all affect their function. Their function is to go and fertilize the egg. When they themselves are not healthy, they are unlikely to be able to fertilize an egg naturally and or spontaneously. So the factors which improve sperm count and sperm quality in men, number of factors are involved. Your diet makes a big difference, I think, personally. The amount of time you spend keeping your testicles cramped and in hot situations actually reduces your sperm count, and we know that for a fact. So Sam, your tight jeans aren't really helping your sperm count right now.
No, I'm easy.
We're having this conversation.
Off air.
Oh.
There's a tweet here by Edgar who's saying, I knew I shouldn't have gotten that vasectomy. And he goes on to say that sometimes men change their minds about vasectomy that they may have gotten a few years earlier. With the new technology, how successful can a reversal among men aged 50 and above be?
Wow. Reversals are rarely successful, unfortunately. Right. So with current technology, now that we have microsurgery involved, the chances are a little better, but not enough to say that you're likely to go back to the fertility that you had prior to the vasectomy. So what's happening is once you have the vasectomy, if you're sure and very confident that you want another baby, right, we go ahead and actually extract the sperm from the testicle itself and use artificial reproductive technology to go ahead and have the babies.
All right. And courtesy of religion and to some point tradition and culture, there are those who, when it comes to family planning, they actually opt for the withdrawal method.
Right.
Let me just put it out there. I was trying to look for a proper term for it, but withdrawal. How effective is this, Doctor?
Right. So when you say withdrawal, Sam,
yeah,
you remind me of the game of Jenga. You know, when we're playing blocks, Jenga blocks, and you actually withdraw. Right. Withdrawal is essentially a man, when having sexual intercourse with a woman, withdraws his penis before he ejaculates. Right. Number one, it's very difficult to do.
It's difficult to do.
It can be difficult to do. Number two, there's a high failure rate. So the stages of sexual arousal in a man allow for something called pre-cum, which is a little bit of the fluid that you're going to ejaculate anyway to pass through the penis and get deposited in the vagina. There's always a possibility that there's a few sperm inside that fluid. Remember, you don't need millions of sperm to fertilize an egg. You need one.
Just one.
You need one successful, healthy winner to go ahead and fertilize the egg.
And usually, when you talk about the need for just one healthy one to do the job, why are men usually fussy about quantity versus quality?
Probably because quality is something that you cannot control, largely. To a certain extent you can, largely you may not be able to. Quantity is what makes the difference, right?
It does?
What they can see.
Let me just clarify the situation. Are you talking about the quantity of sperm in the ejaculate? Right. So the quantity of sperm in the ejaculate, if is higher, then you're more likely to go ahead and fertilize the egg.
The probability.
It's probability.
Yeah.
It's rates. It's looking at what proportion of your ejaculate is made up of active, healthy, normal sperm, and therefore the higher the number of sperm which are healthy, then the higher the chances that you're going to go ahead and fertilize an egg successfully.
But it could also be a blank SMS,
Correct.
as we call them.
Yes.
It could also be a blank SMS at the end of the day.
Yes, absolutely. Yes.
Nice.
Right.
Nice.
So when it comes to subfertility, there are 3 ways in which we look at it. It's either the female partner having problems, in about 1/3 of the cases. And surprisingly, 1/3 of the cases are potentially male. This is the reason why the fertility is a bit of an issue. And in 1/3 of the cases, we don't really know what's happening. Yeah. So yes, increase in quantity of sperm will help in increasing chances of getting pregnant. Right.
Jane.
There's a tweet that I came across here. It's hilarious, but it's also sad at the same time. I'm trying to retrieve it, but in essence, it was talking about how this guy thought that vasectomy would not get his wife pregnant, but it actually changed the color of the baby.
Oh. And very quickly, Annie is asking what sexual health protection solutions are there for menopausal women? Dr.
I would like to not comment on the change of color of baby. With regards to, did you say contraceptive methods for menopausal women?
Sexual health protection solutions for menopausal women.
So menopause is a whole 2-hour discussion on itself, right? And it involves a lot of hormonal changes in the woman. And these affect mood, it affects sex drive, affects their body, it affects how they're feeling in their own body. They can't believe sometimes that it's their own body that's undergoing all these changes. And to add a hormonal aspect of contraception to that particular body is asking for potential trouble. And therefore, personally, I do not offer, or I guide them towards more non-hormonal methods of contraceptives rather than hormonal. Menopause, now that you mentioned sexual health options, we're not talking about just contraception, we're also talking about potentially increasing sex drive. And there's another hormonal battery of tests that we are potentially doing and helping a woman who's undergoing these changes to help increase their, or should I say, make their sexual health more healthy.
Nice. Let me tell you something, Dr. Raj.
Tell me.
You just earned yourself a slot as a resident consultant on this show, because the number of questions that we're receiving when it comes to sexuality and family planning, they're just a boom. And we shall be inviting you back in the course of time to just clarify, take one issue at a time. I think that will be beneficial to our viewers. So we'll just be taking one issue at a time. Today we have shed light on vasectomy. There's still those questions that are coming in from viewers, especially men, when it comes to but thank you so much, Dr. Raj Dodia, obstetric gynecologist at MP Shah Hospital. Jain Wambui, asante sana. My name is Samuel Njoroge. Asanteni sana kwa kuja. Thanks for coming. Enjoy your Tuesday, and I'll be seeing you tomorrow. Good morning.
Bye.